Introduction. Background music fades in narrator. Welcome to today's lecture on papillitis, an inflammation of the optic disc. In this comprehensive script, we will explore the fascinating world of optic nerve anatomy and the various aspects of papillitis, from its etiology and clinical presentation to diagnostic evaluations and management options. We will also delve into the potential complications, long-term sequelae, prognosis, and association with systemic diseases. By the end of this lecture, you will gain a deeper understanding of papillitis and its complexities. So, let's embark on this educational journey together. Background music fades out. Professor, the optic nerve plays a crucial role in transmitting visual information from the retina to the brain. It is composed of over 1 million axons, which form the optic tract upon reaching the optic chiasm. The optic nerve consists of multiple layers, including the nerve fiber layer, ganglion cell layer, inner plexiform layer, inner nuclear layer, and outer plexiform layer. Each layer has a specific function in the processing and transmission of visual signals. Professor, papillitis can have a multitude of causes, including infectious and non-infectious etiologies. Viral infections, such as herpes simplex virus and varicella zoster virus, are common culprits. Autoimmune diseases, like multiple sclerosis and systemic lupus erythematosus, can also lead to papillitis. Other risk factors include certain medications, exposure to toxins, and genetic predisposition. Professor, patients with papillitis often present with blurred vision, decreased color vision, pain with eye movement, particularly retrobulbar pain, and a relative afferent pupillary defect. Upon examination, optic disc swelling, or papilledema, may be observed. Other signs include venous congestion, hemorrhages, cotton wool spots, and disc leakage on fundoscopy. Professor, it is essential to differentiate papillitis from other optic neuropathies, such as ischemic optic neuropathy and optic neuritis. Ischemic optic neuropathy is typically associated with older age and risk factors like hypertension or giant cell arteritis. Optic neuritis, on the other hand, is characterized by acute unilateral visual loss and often occurs in the setting of demyelinating diseases like multiple sclerosis. Professor, diagnosis of papillitis involves a comprehensive evaluation. Visual acuity assessment is necessary to determine the extent of visual impairment. Visual field examination through perimetry helps identify any defects in the visual field. Optic disc imaging techniques, including fundoscopy and optical coherence tomography, allow for detailed visualization and measurement of the optic disc, aiding in the diagnosis and monitoring of papillitis. Professor, laboratory investigations are crucial in investigating the underlying cause of papillitis. Blood tests, such as complete blood count, erythrocyte sedimentation rate, C-reactive protein, and autoimmune panels can provide valuable insights into infectious and autoimmune etiologies. Lumbar puncture and cerebrospinal fluid analysis may also be necessary in certain cases, particularly if multiple sclerosis is suspected. Professor, management of papillitis depends on the underlying cause and the severity of the inflammation. Supportive care, such as pain relief and rest, is essential in all cases. Corticosteroids, both systemic and periocular, are often the first-line treatment to reduce inflammation. In some cases, immunosuppressive therapies may be necessary, especially in autoimmune-related papillitis. Close monitoring of visual function and regular follow-up are crucial in assessing treatment response. Professor, while timely intervention and appropriate management can often resolve papillitis, complications can arise in some cases. These may include optic atrophy with subsequent permanent visual loss, macular edema, central retinal vein occlusion, and even significant neurological deficits, particularly in the presence of associated systemic conditions. Professor, the prognosis of papillitis depends on various factors, including the underlying cause, severity of inflammation, and promptness of treatment initiation. In some cases, visual outcomes can be favorable, with complete resolution of symptoms and restoration of visual function. However, in severe or chronic cases, residual visual disturbances or permanent vision loss may occur. Professor, papillitis is often associated with systemic diseases, providing important clues to the underlying etiology. Multiple sclerosis, an autoimmune demyelinating disorder, frequently manifests as optic neuritis but can also involve papillitis. Sarcoidosis, another systemic disease, can affect multiple organs, including the eyes, leading to granulomatous inflammation and papillitis. Professor, while papillitis often presents with typical signs and symptoms, there can be variations in its presentation. Atypical forms of papillitis may have subtle or different clinical findings, making the diagnosis more challenging. Rare forms, such as posterior ischemic optic neuropathy, posterior uveitis-related papillitis, or drug-induced optic neuropathy, require heightened clinical suspicion and knowledge of unusual presentations. Professor, long-term management of papillitis involves regular follow-up visits to monitor visual function and assess treatment response. The frequency of follow-up visits depends on the severity of inflammation and the underlying cause. Ongoing evaluation, including visual acuity assessment, visual field testing, and repeat optic disc imaging, allows for the identification of persistent inflammation or development of complications, guiding treatment adjustments when necessary. Background music fades in. Thank you for watching our video on papillitis. This condition involves inflammation of the optic disc and can have serious implications for vision. By understanding its complexities and using proper diagnostic and management techniques, we can make a positive impact on our patients' lives.